Hello, and welcome to the IU Chest Radiology Department. We are delighted to be involved in your care. You are viewing this video because you're scheduled to undergo a biopsy of a mass or nodule in your chest. Prior to the procedure, you'll have an opportunity to speak with the radiologist performing the biopsy. A radiologist is a medical doctor who specializes in the interpretation of medical imaging obtained by various scanning modalities, including X-ray, ultrasound, MRI, and of course, CT scans. From your prior CT scan, your doctor will know which lesion is to be targeted. Once a decision has been made to proceed with the biopsy, the doctor will ask you to sign a consent form. The consent form is a document consisting of several pages that outline the risks and benefits of the procedure. After speaking to the doctor, a technologist will guide you to the CT scanner. There, the technologist and a nurse will begin preparing for the procedure. You'll lie on the CT scanning table, much like when you had an imaging exam in the past. Depending on the location of the lesion, you may be asked to lie flat on your back, on your stomach, or on your side. You'll be moved in and out of the CT scanner a number of times throughout the procedure. The initial scans will confirm the findings seen on your prior imaging and allow us to better localize the lesion for biopsy. Upon completion, the technologist will review the images with your doctor in a separate, nearby room. This process can take about 5 to 10 minutes. More images may be acquired. This does not necessarily indicate a problem. Prior to proceeding with sedation or biopsy, a timeout will be performed. This is a safety check that is meant to review patient information, relevant history, medical allergies, and the procedure to be performed. Confirming these items as a team allows everyone to be on the same page. Your doctor, while wearing sterile gloves, will start by cleaning the skin overlying the target lesion with an antiseptic solution using sterile supplies. After the area is cleaned several times, a drape or sterile towel will be placed around the area to create a sterile field. These measures aim to prevent germs from coming in contact with the outer and inner portions of the chest along the path of biopsy. This helps to prevent infection, which is an uncommon complication of this minimally invasive procedure. After prepping the skin, your doctor will introduce a local anesthetic, typically lidocaine. It will be administered via a tiny needle. You'll feel a pinch and a burn, but the area will quickly lose sensation. Additional numbing will be applied to the surface of the lungs, or pleura, and any deeper tissues as needed. Throughout this process, your doctor and nurse will monitor you closely. In some cases, intravenous medications may be used for pain control and/or sedation. The doctor will then begin to insert a small needle under CT guidance. This refers to the process of using a CT scanner to take pictures of the biopsy needle as it enters your body and moves towards the target lesion. During this step, the table you're lying on will move in and out of the CT scanner several times. Often, a hollow core needle will be used to maintain access and position, while the biopsy device itself is removed between samples. This allows for convenient repeated access to the target area. As the biopsy proceeds, your doctor will take into account the constant motion of your chest and lungs during normal breathing. However, you may be asked to briefly hold your breath at various points during the procedure. Once access has been established, your doctor will choose one of two techniques to obtain the best sample possible. The first is called fine needle aspiration, or FNA for short. This involves inserting a tiny needle into the lesion and sucking up cells with the help of an attached syringe. Alternatively, there is a technique called core sampling. This involves a slightly different device that cores out a tiny sliver of tissue containing many cells. The adequacy of the sample is determined by a pathologist who will be in the department at the time of the procedure. A pathologist is a medical doctor who specializes in evaluating tissues and cells obtained from various parts of the body. If the biopsy sample is considered inadequate, the pathologist may request that additional cells be acquired. However, ultimate adequacy can only be determined after final preparation and review, which will occur in the lab over the next several days. Bleeding is another common complication of most procedures. Please let the radiologist know if you're on blood thinners such as aspirin, since these medications slightly increase the risk of bleeding. If you're on other blood thinners, your doctor will have asked you to refrain from taking them for multiple days prior to your procedure. If you did take them, you may need to reschedule the procedure to reduce the risk of bleeding. It is important to remember that some bleeding is expected when taking samples of tissue from any part of the body. The amount and duration of bleeding from a biopsy varies from person to person, but it is typically mild and rarely requires additional intervention. In the case of a lung biopsy, blood can make its way into the nearby airway or bronchus. It is not uncommon for the body to expel some of this blood by coughing, either during or immediately after the procedure. If this occurs, it is not a cause for concern. After you leave the hospital, any blood in the sputum should be minimal and will appear rust-colored, which indicates old blood. Rarely, patients may experience concerning symptoms after returning home, such as coughing up bright red blood. If this occurs, you should seek medical attention at the nearest emergency room. Since the entire biopsy procedure will be guided by CT imaging, your radiologist will be able to directly visualize the location of the needle and/or biopsy device. Because of this, there is only a minimal risk of damage to nearby structures, which include the heart, its lining, and the major blood vessels. In cases where the target lesion is within a lung or near its lining, it is possible for air to leak out along the tract of biopsy. Often, the leak slows and stops over the next several hours in recovery. However, air can sometimes accumulate in the pleural space, which is the area between the rib cage and the lining of the lung. This event is known as a pneumothorax. If this occurs, you may feel some shortness of breath or discomfort with respiration. You'll be closely monitored during and after the procedure for development of this complication. An X-ray will be taken immediately following the biopsy, and this will be repeated several times before you leave the hospital. In the event of a pneumothorax, you may be cleared to go home if your symptoms are mild and the amount of trapped air is not increasing. Conversely, if you begin to experience increasing shortness of breath at home after the procedure, particularly while performing normal daily activities, you should seek medical attention at the nearest emergency room. In approximately 5% of cases, the volume of trapped air is large enough to require placement of a chest tube. This is a small plastic tube connected to a water seal device, which allows air to escape without re-entering the thoracic cavity. Patients with a chest tube require at least 1 night of monitoring in the hospital while the lung heals. Despite proper technique, the nature or position of a lesion can make it impossible to acquire enough cells to make a diagnosis. In such cases, an alternative management plan may be suggested. Options might include following with repeated imaging, surgical consultation, or even a future attempt at biopsy with potentially a different method. You'll be observed in the post-procedure unit for several hours following your biopsy. We ask that you try your best to lie flat and remain relatively still while avoiding excessive talking or activity. This is particularly important during the first couple of hours as it helps to limit the risk of pneumothorax and bleeding. You may be asked to lie on the side where the sample was taken. This allows the other side of your chest to do the work of breathing. While you're in recovery, your doctor will review your clinical status and x-rays in order to determine when it is safe for you to be discharged. Afterwards, you'll be asked to fill out a short questionnaire that will provide us with valuable feedback. After leaving the department, you may experience mild discomfort in your chest at the site of biopsy once the effects of anesthesia wear off. The pain may be pleuritic in nature, which means that it is sharp and occurs with deep breaths. This is due to irritation of the lining of the lung. This is normal and may be eased by over-the-counter painkillers such as Tylenol. Should you develop worsening shortness of breath, changes in the type or degree of pain, or other concerning symptoms, you should seek medical attention at the nearest emergency room. The results of your biopsy are typically available within 3 to 5 business days. They'll be sent to the doctor who ordered the procedure. Please share any questions or concerns you may have with the technologist or radiologist. Thank you for letting us assist in your care.